Hey, welcome to my channel. Thank you so much for joining me on this one. So today we are talking about a health condition which is called Diastasis Recti. So before I go into that, my name is Joyce and I'm a physician associate and I work in general practice here in the UK. So on this channel we talk all things health, wellness, and also informing one another of some very important health conditions that we all need to be aware of. So if you're someone who is interested in health, I think everyone should be interested in their health. This is the channel for you. So I'll dive straight into the video and we are talking about Diastasis Recti. So what is Diastasis Recti? So it is basically ab separation. So it's the separation of the abdominal muscles which are called the rectus abdominis. So that is a mouthful, but basically this usually occurs pregnancy, weightlifting. If you're someone who's weightlifting and you're not taking care of your abdominal, then you can have that ab separation. If you are someone also who is overweight, that also means that you are more likely to have this condition. And also if there is a family history of this condition, then you might be prone to having it as well. So what are the symptoms of Diastasis Recti? I personally have had this condition after pregnancy. So what occurs is you find that when you lay down facing up and you crunch up, so how you measure that is you use your fingers. So some would be having 5 fingers where that gap is, others will be having 2 fingers, 3 fingers. So that's how that can be measured. So definitely post-pregnancy you can have this. What are the other symptoms? You might find that you would have back pain with it, and you can have digestive problems concerning as a result of the condition as well. In terms of investigations, usually when you go to see your general practitioner, your family doctor, they can examine you. They will ask you to lay down facing up, and they will do examination on you, your abdominal examination, and also check for the gap if there is a gap there. Like I said earlier, that's how it would be classed as it's a 3-finger width or 2-finger width, 5-finger width, depending on the sizing. Another thing that might be done is an ultrasound scan. Not routinely done, but that can be done as well as a follow-on investigation from the original physical examination. What is the management? So I have done a video which goes through the exercises that you would need to do to close that gap. So you need to train those muscles so that you can close the gap. So definitely physical exercises geared towards those ab muscles is the most appropriate treatment, and usually that works. The only thing is, I need to warn you, you definitely need to be consistent with it. So it's not something that you do once and then, magic happens. You will definitely need to be very consistent with it daily for 2-3 weeks or even longer than that. And then those ab muscles are going to close, or at least the gap will be smaller. So unfortunately, if you do become pregnant again, if you've had Diastasis Recti, then you have a higher risk of having it again in other pregnancies. The other thing that you can do is to brace. So to wear a brace, that will also encourage your abdominal muscles to come back together from that separation as well. And if all those things have not worked, then the last resort would be surgery, although rarely that happens, but it can happen if your ab separation is really severe. Okay, so I do hope this has been helpful. This is very relevant for, like I said, most women who've had children or are postpartum. If you've had twins as well, that also increases your risk. And if you're someone who does heavy lifting, or if you do a job that involves heavy lifting as well. So I hope you enjoyed this video, and I will catch you on another one. Please do share your experiences. If you've had this condition, or if you still have it, or maybe you've closed the gap, please share your tips on how you managed to do it. I hope you've enjoyed this video. If you have, please subscribe, like, and share with those that you think would find this helpful. Otherwise, I will catch you on another video. Bye bye.